November is National Epilepsy Awareness Month, a time to raise awareness and support for the epilepsy community. And according to the Epilepsy Foundation, 1 in 10 people will have a seizure and about 1 in 26 will develop epilepsy during their lifetime. Here to talk about that and the neurological disorder is Dr. Chad Bush, a neurologist and epilepsy specialist over at Denver Health. Dr. Bush, I promise you're going to show up here in just a second. There you are. Thank you so much for being here. I appreciate this. When you talk about epilepsy, you talk about 1 in 10 people have a seizure, 1 in 26 will develop epilepsy.
Yeah.
When you think of it, I think you think of people who have seizures or a potential disorder like that. What exactly is it, and then how does it develop in people?
So epilepsy is really it's a brain disorder characterized by an enduring predisposition to having seizures. And like you said, 1 in 26 people will develop epilepsy in their lifetime. That enduring predisposition is really defined as a person having at least 2 unprovoked seizures or 1 unprovoked seizure with evidence of an increased risk of having further unprovoked seizures.
Okay, so I think we know what it looks like when someone has a seizure, but what's kind of going on inside that person at the time?
A seizure, is caused by abnormal excess electrical activity in the brain. And a seizure can certainly look like what we all think of, what you see on videos and on movies, of like large shaking and jerking convulsions.
Yeah.
But seizures can also look like much more subtle things with just behavioral arrest, staring, loss of awareness, inability to speak for a period of time, that sort of thing, all depending on where in the brain the seizure is coming from.
Sounds very scary. Sounds like it could be life-threatening. What is the treatment for someone with it and the prognosis these days?
Yeah, for sure. So, nowadays it's pretty great. We have, around 30 different seizure medications that we can choose from. And that's the mainstay of treatment to when a patient first presents with epilepsy and seizures, is to start a medication. Usually, about 60 to 70% of patients will respond to that first or second seizure medicine that we try. But for those patients who don't respond, who continue to have seizures despite medications, there are other options. And at that point, I would recommend that those persons with epilepsy are referred to a surgical center, a level 4 epilepsy center, such as Denver Health. There are a few others in the community where we can talk about other options for treatment, such as the ketogenic diet, as well as surgical options, neurostimulator devices that are implanted, as well as like actual epilepsy surgery.
Quickly, I'm just curious, why the ketogenic diet?
Yeah, ketogenic diet is very interesting, and we're not exactly sure exactly why it works, but it is more effective than medications in terms of controlling seizures. The problem with the ketogenic diet, of course, is that if you decide to eat a piece of cake.
Right, you get off of it if you're out of that ketogenesis.
Have a seizure, right? So for a lot of adults, it might not be the best option, but for especially kids with refractory seizures, it can be very useful.
Very quickly, if people have more questions or they know someone who has it, they think they may have had some of these small seizures themselves, what do they do to get in touch? Denver Health, the Epilepsy Foundation?
Yeah, so either one of those would be great options. You can call the Denver Health clinic appointment line and you can get in to see an epilepsy specialist. Alternatively, the Epilepsy Foundation of Colorado and Wyoming is a great resource for persons with epilepsy and their families and friends.